TJ is a 6-year-old female, and she presents to the clinic today with her mother. The chief complaint for this visit is right ear pain and fevers. The initial fever started on Wednesday, and by Thursday she developed right ear pain. The pain is described as throbbing and intermittent, and the fever and pain are persistent until mom gives her Tylenol or Motrin, which then it helps subside. Mom has been alternating those medications over the last 3 days as well. Unfortunately for the patient, she does awaken with pain, and mom states that she isn't as playful as she typically is. The patient doesn't have any allergies to food, medications, or to the environment, and also doesn't have any past medical history, but mom does share that she has had about 2 to 3 ear infections in the past, but none in the last 6 months. The only pertinent family history is that mom is a smoker, but doesn't smoke in the house or around the child. The patient is in school. She also does daycare after school, and she lives in a stable living situation, single family home with just mom, and there are no known sick contacts. We went and did some vitals on the patient. She does have an elevated pulse rate at 125, and also has an elevated temperature, 102 degrees Fahrenheit. All other vitals were normal. We went ahead and we did an assessment on the patient. We looked at her eyes, ears, nose, and throat, and also palpated her lymph nodes. We listened to her lung sounds and her heart sounds. There was no significant findings aside from the right ear. When I looked in it with the otoscope, I saw a very erythematic tympanic membrane with exudate behind it, and it was bulging as well. The patient winced in pain during that part of the assessment. The left side had pearly gray tympanic membrane, and it was a happy looking ear. And no pain was assessed when I palpated the outer ear. So my differentials for this visit is acute otitis media versus mastoiditis. In the acute otitis media, she definitely had the classical symptoms and presentation with the erythematic tympanic membrane and the exudate behind the membrane. For mastoiditis, I didn't really see any erythema around the ear, on the outer ear, and there was no pain upon palpation around the surrounding tissue. With that, I would ask if you have any recommendations on how to further assess mastoiditis, maybe even give me some tips on how to assess that in dark-skinned patients as well. And maybe some recommendations for patients that are allergic to amoxicillin. How would you treat either? With that being said, we're going to treat her today with amoxicillin for acute otitis media. One thing I would stress to mom is to prevent smoking and secondhand exposure, as well as to continue doing the Tylenol and the Motrin alternatively to help treat the fevers. And if she isn't feeling better in about 3 days, that she can come back. If she notices that the fever is also persistent and that she is looking like she's dehydrated, then to please either call or go to a local ER. With that being said, something I would like to brush up on is just different concentrations of amoxicillin and what might be more pertinent for her. Would a higher concentration be better because it's less for her to intake? Or for someone her age, would that be a little too upsetting on her stomach? Thank you.